I'm Dr. Sara Cody from the Santa Clara County Public Health Department, and today we're going to talk about what you want to know about pandemic H1N1 flu. This talk will cover three different things. What is it? How can I protect myself? And what if I get sick? So what is it? We'll talk about who's at risk, what are the symptoms, and how is this flu virus spread? And under how you can protect yourself, we'll just talk about some tips for staying healthy and a little bit about the H1N1 vaccine. And finally, what if you get sick? How can you take care of yourself and your family? So what is pandemic H1N1 flu? Well, the word pandemic means three things. First, it's a completely new virus that everyone is susceptible to. And second, it spreads easily from person to person and keeps on spreading. And finally, the pan part of pandemic means that it spread worldwide and affects people all around the globe. So the word pandemic tells us how far the flu virus is spread. However, it does not tell us how mild or serious the illness from the new virus may be. So why be prepared? Well, remember, this is a new virus, so everyone who's not been vaccinated or infected already has little or no immunity or protection against it. The pandemic H1N1 flu has been widely circulating this fall and continues to circulate. That means that a lot of people have and will still get sick, so you do need to plan and prepare. For example, make backup childcare arrangements, or if your child gets sick, or if you get sick, stock up on over-the-counter medications at home. We all need to do our part to limit the spread of disease in our community. So who gets sick with this pandemic H1N1 flu? Children and young adults are most likely to get H1N1 flu. And in fact, when we were attempting to count all the cases of H1N1 infection in the spring of 2009, 73% of the reported H1N1 cases were in people less than 25 years old. People over 65 years are much more likely to have some natural immunity to the H1N1 flu and are much less likely to become infected. So for example, only 1.3% of the reported H1N1 cases in the spring of 2009 were greater than 65 years old. But it's a little bit of a different story who's at risk for severe complications from H1N1. The question is, who's most likely to become seriously ill and require hospitalization if they get sick with H1N1? And there are three main groups. First, it depends on your age. The very young, those less than 4 years and especially less than 2 years, and the older population, those 65 years and older, are more likely to become hospitalized if infected as compared with other age groups. And second, pregnant women have disproportionately higher rates of hospitalization and even death from H1N1. And finally, people with chronic medical conditions are more likely to have severe complications. Medical conditions that put people at greater risk include chronic lung disease, including asthma, chronic conditions of the heart, liver, blood, or metabolic system, including diabetes, and any condition such as HIV or drugs such as chemotherapy that would compromise the immune system. In addition, people age 19 or younger who are on long-term aspirin therapy are at risk for a condition called Reye syndrome if they get an influenza infection. The symptoms of H1N1 flu are similar to seasonal flu, and they include a number of different symptoms, including fever, body aches, chills, headache, sore throat, cough, runny or stuffy nose, and fatigue. A number of people infected with the H1N1 virus have also reported having diarrhea and vomiting. So how does H1N1 spread from person to person? Well, it turns out that pandemic H1N1 flu spreads just like seasonal flu. And flu viruses are spread mainly from person to person through coughing and sneezing by people who are infected with influenza. All flu viruses, including H1N1, can survive on hard and smooth or non-porous surfaces. Sometimes people may become infected by touching something, such as a surface or object with flu viruses on it, and then touching their mouth or nose. This H1N1 flu virus is not spread by food. So how can you stay well and help us fight this flu? You can stay well and help fight the flu by adopting a few common sense practices. First, wash your hands with soap and water often. Second, avoid touching your eyes, nose, or mouth. And stay away from sick people as much as possible. Keep surfaces clean, and as supplies allow, please get vaccinated. A further note on vaccine, the H1N1 vaccine supply is still somewhat limited in Santa Clara County, but as of late November, just under 300,000 doses had been shipped to providers throughout our county. We expect an additional 210,000 doses over the next 6 weeks and anticipate that H1N1 flu vaccine will continue to flow into the county. With these still limited doses, who should be vaccinated first? Our efforts are still focused on 5 key groups, and those groups include pregnant women, people who live with or care for children under 6 months of age, people between the ages of 6 months through 24 years, and people ages 25 through 64 who are at higher risk for novel H1N1 because of chronic health disorders or compromised immune systems. And finally, healthcare and emergency medical services personnel. We estimate that about 800,000 residents of Santa Clara County will fall into one of these 5 groups. While you're waiting for the flu vaccine, there are a few other things you can do. Monitor yourself and your household for symptoms of flu, and if you do get sick, please stay home from work or school and keep your children home as well. If you're 65 years or older and have a chronic health condition, make sure you get your pneumococcal vaccine. What to do if you or a family member are sick? If you're sick, your goals are to take good care of yourself or the person who's ill and keep spreading your illness to others. Contact your medical provider for early treatment with antiviral medications if you or the person you're caring for falls in one of the following groups. If they're pregnant, less than 2 years old, greater than 65 years old, or have one of the chronic medical conditions we mentioned earlier. Also, if you have severe symptoms, please seek medical help. If you go to a doctor's office, clinic, or an emergency department, call ahead and tell staff that you have flu symptoms as soon as you get there. You can also treat fevers and aches with over-the-counter medicines, drink plenty of clear fluids, and get plenty of rest to heal soon. And finally, keep from spreading your infection to others. You can do this in a number of ways. First, stay home for at least 24 hours after your fever is gone without the use of medication. Remember, cover your nose and mouth with a tissue when you cough or sneeze into your sleeve, and continue to wash your hands frequently. So what else can you do? Well, you can plan and prepare. Every person and family should plan and prepare. Have a plan if your kids get sick or if the schools close. Employers should have a plan for periods of high absenteeism. Visit our website at www.sccphd.org and look for the home care guide for more details about how to prepare at home. And practice good health habits. Eat a balanced diet and get plenty of rest. So stay informed. Check out the Public Health Department's website at www.sccphd.org and the CDC website at www.cdc.gov/H1N1 You can also find the Public Health Presence on Facebook, and you can subscribe to the Public Health Department's e-newsletter. Thank you very much for listening today. I hope that answers your questions about H1N1 flu. Again, if you have more questions, go to our website. Thank you again. This is Dr. Sara Cody with Santa Clara County Public Health Department.